Thus, the COVID-19 vaccine made by Pfizer and BioNTech will likely take longer to be available in sub-Saharan Africa. This is because its use was approved for emergency use authorizations instead of developers pursuing full licenses. Public health lawyer Safura Abdool Karim says expediting approvals, including emergency use authorizations, may be an option for wealthier countries, but they are not something poorer countries can emulate. Safura joins us live now to talk about this. Safura, good evening, and certainly thank you so much for your time tonight. Let's just begin with talking about the relationship between vaccine approval and vaccine rollout.
Thank you so much for having me. And I think this is an issue that not a lot of people have looked at. The key issue in South Africa is that the government, under our current laws, are unable to procure a vaccine until it has been approved by Safra. There's a very close link, and it's not just here, it's globally, where you see a government or agency like the FDA or the UK's regulatory authority, they give emergency use authorization to a vaccine, and within a week, the vaccine is being rolled out. So when we approve a vaccine, that could be a key linchpin in rolling it out across South Africa.
Could that be possibly the reason why we're then seeing this delay?
So it's definitely part of the issue. So typically, when you look historically at medical interventions, what you see is that there's a 4 to 7 year delay between approval being granted in a high-income country and that intervention being rolled out in a low or middle-income country. Now, with COVID, we've seen many unprecedented things, and one of the amazing things is that we've seen that delay is not 5 or 7 years, but it's shrunk quite considerably. So we're seeing wealthy countries rolling out vaccines, and then quite fast behind them, other middle-income countries like Mexico and Costa Rica rolling out vaccines as well. So we need to seriously think about how we can expedite that vaccine approval process, see a vaccine rolled out as quickly as possible.
And when you look at then the delays, when it comes to addressing the approval, what has South Africa done to address the delays in approval and to make sure that, this vaccine gets here as quickly as possible?
So the briefing on Sunday outlined some interesting measures that Safra has taken to try and expedite vaccine approvals. They've done 4 things. The one is they have agreements with the FDA and other agencies like that who have approved vaccines, who have almost like a mutual recognition where those agencies can share information with Safra. So that will go a long way in expediting things. Then they've also introduced some flexibilities around packaging and labeling requirements. That means that vaccines that are produced elsewhere that are being distributed in other countries can also easily be distributed here without having to redo all the packaging. They have introduced, they say, a fast track process for a COVID vaccine that will hopefully make the approval process much faster. And what they've said is, if companies don't submit dossiers to Safra, which none have so far, then they will pursue a Section 21 bulk approval for a vaccine. Now, I think the only shortcoming in this approach is that we're being very reliant on these companies to submit dossiers instead of approaching those agencies that they have agreements with to get that information as soon as possible.
And let's look then, of course, at the impact of these countries. I mean, countries like the US, countries like the UK, and, you're looking at how quickly things have moved for them, as you said earlier. What impact will this have on South Africa's vaccine rollout?
So what we saw in sort of October and November last year was there were several countries that opted to roll out things like the Sinopharm vaccine or Sinovac vaccine, the Sputnik vaccine from Russia. And these vaccines were rolled out under emergency use authorizations, which meant that their efficacy didn't need to be shown. And these vaccines, the countries that rolled them out, like the United Arab Emirates, they didn't wait for phase 3 results to show that the vaccine was safe and effective. They just granted the emergency use authorization and were able to access the doses that were available without having to compete with many other countries, because nobody wanted to procure the vaccine before it was effective. Of course, now that efficacy has been shown of a whole lot of candidates, there's now a huge rush to try and get access to the vaccines that are effective. So those countries that opted to grant that emergency use authorization managed to skip the queue. They took a bit of a gamble in terms of whether the vaccines would work or not. And for some of them, that gamble has paid off.
And I see, of course, as you know, that particular gamble that you talk about, South Africa has really been criticized by some for not really taking it here. And countries like Morocco, Argentina, and India also approved the rollout of that, of vaccines. Can South Africa do the same here?
I think that is a policy decision that SAHPRA needs to consider, which is what is the threshold of evidence they need. India has been criticized for rolling out a vaccine that doesn't have full efficacy data, that a vaccine that may not work. So SAHPRA needs to think very carefully about what is the balancing act they're going to play. How much are they going to wait for the efficacy results to be released before procuring? Because there's a very clear tension here. The longer they wait, the more certain they may be, but the doses may be taken up by countries that have jumped the gun in terms of approving quickly.
And I wanted to really just tally at the back of that because, as you said earlier, this is an unprecedented situation. Certainly nobody could have foreseen. Do you think that at this stage it is wise to stick to the policies or even look at what you're saying, that with SAHPRA probably just thinking about changing policies altogether or even kicking the rule book out the window and just doing what needs to be done here?
I think the thing that concerns me the most is that there are no dossiers filed with SAHPRA, and they have indicated a very clear intention to wait for companies to file those. I think that SAHPRA needs to be proactive, get the data from other agencies and start doing the internal evaluations. We have clinical trials running for some of these candidates. So some information is available to them so that they can begin preliminary evaluation and potential approval of these vaccines. And I think they need to seriously consider whether or not South Africa should be following the route of an emergency use authorization for some of these candidates to expedite access.
Talk to us then about, candidates like Sinopharm and Sputnik, because some of the countries have rolled them out, but there was a lack of efficacy data. But I see that that is starting to trickle in.
So as far as I'm aware, Sinovac has now completed phase 3 trials and could potentially share that information with us. And I think it does make sense for at least preliminary results of a phase 3 trial to be released before you start considering approval. But you shouldn't do away entirely with that requirement, But I think there is a need now to change the playbook a little bit and start approving things. We can't just wait for dossiers to be filed. We've got to be proactive in approaching other government agencies that have approved the vaccines and see how we can use those approvals to expedite evaluation and approval in South Africa.
And Safura, there's been quite a lot of talk around the non-disclosure agreements that are said to have been signed here, and people saying that these non-disclosure agreements could put South Africa at a disadvantage. Is that the case?
I think what one has to understand is that non-disclosure agreements are very specific to the parties involved. So we don't know what the content of the non-disclosure agreements are. We don't know what type of information is being contained there. However, what I will say is there is precedent in other countries where if a government procures something for a very low price, they agree not to disclose certain elements of the pricing structure. Sometimes they agree not to disclose the price, and that's because it would undermine the company's ability to obtain profits elsewhere. So all I can say is if the NDAs are helping us get a more affordable vaccine quickly, then they could be justifiable. But at the same time, we are dealing with taxpayer money, and there is a level of transparency that is needed there.
Thank you so much for your time tonight. That was Safura Abdool Karim, a public health lawyer, discussing the options available to government for speedier approval processes for vaccines to beat the red tape usually involved